A really connection between type 2 diabetes and your gut health? Well, some of the studies are showing that there might be some connection between the two, and they're really diving deep into this because this could be a very significant thing to help reduce the onset severity of type 2 diabetes. Now, as a pharmacist, Joe RxHealthyHabits, I know after 40 years of working in the pharmacy world just what a huge problem the prevalence of type 2 diabetes is. Right now, about 12% of the population has diagnosed with type 2 diabetes. Now, here's the other in type 1, but type 2 is by far the largest. Type 1 is an autoimmune dysfunction where your body destroys its pancreas. Type 2 is where you have reduced insulin sensitivity. And so here's the thing though, it's a huge factor that leads to cardiovascular disease, neuropathy, and kidney failure. And in some cases, if it's not treated, blindness. But the cardiovascular effects alone are massive, as well as the neuropathy. Huge problem. Huge amount of morbidity associated with this and mortality with uncontrolled type 2 diabetes. Now, the gut's microbiota role. Here's what they think. There's trillions of microorganisms there. They think that it's got a role in the metabolic process, including blood sugar regulation and insulin sensitivity. So there may be an effect with your biota, your gut health, and your gut microbes to help increase your insulin sensitivity. So in type 2 diabetes, that's critical. So they're looking at different ways to personalize interventions with patients that might say, hey, okay, we really looked at their gut health as a way to help us increase insulin sensitivity so they get, better control of their diabetes. So this has opened up a huge area of research. And they find, though, that and there's certain bacteria they're finding in the gut microbiota that help increase insulin sensitivity and some that help reduce it, which is not a good thing. So they're finding ways, which ones are the most critical ones. That's kind of interesting. They also saw that if there's increased monosaccharides in the gut, you got higher insulin resistance. So carbohydrate metabolism may also be affected by the gut bacteria, which is huge. Inflammation and insulin resistance. Inflammation typically is a big problem that can lead to elevated blood sugars and disrupts the insulin signaling. So inflammation leading to insulin resistance, always a problem. Now, probiotic potential. So they're really looking at different ones that may help. They're also looking at how these can help restore the microbiota, especially the good bacteria that might help with insulin sensitivity. So there's a lot of references to this. Again, I can't do a deep dive on it. There's too much here. I just want to make your awareness to it. So they're looking at also some things like butyrates as associated with insulin sensitivity, and there's certain gut bacteria that make a lot of the short-chain fatty acids that help influence the glucose metabolism. So interesting. There's metabolites from the microorganisms that lead to this increase in the butyrate immune system interactions. So they're looking at how this chronic inflammation can lead to some problems. And then there's this gut-liver axis that you got to read about. And it really talks about how the insulin resistance is taking place because of the inflammatory pathways, and it helps regulate that. So it's kind of interesting. So if there's a really bad imbalance in your gut microbiota, that can lead to that. Now, of course, I think diet and microbiota, if you're eating a diet for a good gut health, guess what? Typically, it's lower in highly refined sugars, starches, carbohydrates. It's more lean protein, vegetables, fruits, whole foods. It's going to lead to a better microbiota, but also those diets usually lead to better outcomes when it comes to type 2 because you're not eating a lot of highly processed starchy food. So anyway, here's the implications, and then we're going to wrap with this. They're looking at diagnostic biomarkers from the gut health microbiota. So they are actually going to tell your risk factors for developing type 2 and maybe how quickly. They're going to develop personalized nutrition to really amp up your good microbiota to be a preventative if you look like you're circling the drain for type 2 diabetes. The probiotic and prebiotic therapies and diets, but typically some supplements that they're looking at, which I think is fascinating. And overall, I'll tell you why I like this. There's still so much to be done, and nobody can draw conclusions about any of this yet. They got a lot more to do. But the point is, what I like about it, it's a holistic approach, and it's really about changing what you're eating. But also, if this could be something that shows that your microbiota could affect your type 2 diabetes onset, severity, and how you insulin sensitivity without having to rely just on pharmaceuticals, it's a win. Now, again, not enough there yet, but they're pointing to the fact there could be links. So hope this information helps. As always, come to our blog. All the information's in there. A lot more of a deep dive. And I just want to leave you with the fact that if you could really dial in your gut health, you might have some benefits beyond just what you think is the results of having bad gut health. And that's some of the symptoms, okay? So hope that helps. Until next video, God bless.